For today's purposes, care coordination is going to be the tab that shows the two different modules, TOC viewer and manage acres. So TOC viewer, if I click on that, that is going to open up to the landing page for the TOC viewer. And if there was patients that had an ADT message based on the default range, which is 3 days, right? So 513 to 515, they would show up right down here under ADT. Well, this is a demo environment essentially, or demo patients we're looking at. And I know there hasn't been an ADT in the last 3 days. So what I'm going to do is I'm going to search by 90. So I'm going to click 90 and hit filter. And I should see that patient we looked at in the screenshot, which is House Ranch. So that patient should show up here. Let me take a look. There we go. Okay. So what happens is when I filter by date range, any A0, any of these types of messages, right? Admits, transfers, discharges, registrations, outpatient, inpatient, that's like a transfer, would show up underneath this ADT list, if you will. So I have one patient. So what do you do from here? Right. So you can open up this patient by clicking the hyperlink. You can look at basic information. So if there was a provider name, that would be here. Here's the message date. It was from 415. This one came, their insurance is U of M health plan, and they were admitted on 415. Over here is if there was a care summary on this patient, you would click this and it would pull up that continuity of care document. If you wanted to look at the ADT, you could. So you could look at this PDF and it's going to create a PDF for the ADT notification. So this over here in this section is just really uh, basic demographic information. And so it's going to essentially download a PDF, and then you'll get the message information, event information, patient ID. So this is going to be all their demographics, right? First name, last name, address, phone number, any relevant information upon admit. Here's the guarantor, right? So information on that patient, insurance information, and so on. So that's if that's something you needed, then you could just simply, you could print that, download it, do what you need to with that ADT. Okay. Again, other ways to sort up here: first name, last name, by facility. Oh, I was going to show you this. So like here's a drop down. So here's Bronson, Spectrum, Beaumont, right? These should say Corewell, but we built this a while ago. So those are different drop downs for sending facilities. Or if you knew the name, you could put it in there. You could do it by type. So if you just want to see the hospitals, you could do hospital or just the SNFs, home health, what have you. And then this is how many ADTs per page, right? So if you just need to see the top 25, or you could change it to, whatever parameters you want. So if I were to open up House Ranch, so you've already got, you know that they were admitted. And so from here, you're going to see a few things. You're going to see this whole section up here is going to be demographics again. So it's just kind of a repeat. Down here is the care team. So this tab says care team. This would be other care team members, like I mentioned before, like maybe another specialist or a clinic that also names them as one of their patients. So for instance, and these don't have any associated physicians with them, but this would say like Dr. Smith, Dr. Smith's NPI. Dr. Smith works at Sparrow Hospital, which is part of Sparrow Healthcare System, right? So which is the managing organization. So this might be, if it's a practice, say ABC Gastroenterology, and the managing organization is Answer Health, right? That would be like the PO that would be there. And then over here's the patient information, and then the status, just showing that that they are declared as a patient of this care team member. That's what that is. Documents and consent. The consent tab is kind of a placeholder. That's not alive, so you shouldn't see that. And then documents, that would be if there was a continuity of care document that I mentioned, and there's not one for this patient. But if there was, then if I open that up, you'd see that CCD here. So within that continuity of care document, you could find some clinical information, right? You could see some labs, you could see medications. That will also be available in the new Viper. And so how you would get to the new longitudinal record is this tab right here. Today, inside of my gateway, this says View Viper. So for those of you that are using this currently, it says View Viper. For those of you that have never seen this, you're going to now see longitudinal patient record. And this tab will be available here in the TOC viewer. It will also be available at that home screen. So I'm going to jump back for a second. If I were to type in a patient, and I'll just give you a quick. So I know this is an ID for a patient that we have. So I pulled up this patient because I knew her ID. It's Jessica Clark. I click on Jessica Clark and see here longitudinal patient record. So you're going to be able to get to the new Viper from a few different modules. You'll be able to get to it from the patient viewer, right? The home. You'll be able to get to it from TOC viewer. And then manage acres is going to be that section where Katie had mentioned we're not doing a training, so to speak, on this right away, but this will be, once you do this a couple of times, it'll be pretty familiar to you as far as how to add a patient. So it looks similar to the TOC viewer, but you would put patient information in here and then click add new relationship. And then that does that in real time. And once you do that and your patient pulls up, then you would also see that longitudinal record. So you'll see it in 2 or 3 places, which is good because we want you to have access to the clinical information, which is essentially what you're looking for. The ADTs are going to be the triggered events, as you know, and then the clinical information is what you're using for chart prep or, that type of thing. So